Hello, everyone. Thank you all for coming out. Today, what I'm going to do is present to you a PowerPoint presentation and give you my recommendation as to whether or not our business should move forward or our company should move forward in expanding to Michigan. And what I'm going to do is present to you the Illinois healthcare reform. Then I'll present to you the Michigan healthcare reform. And then after that, what I'll do, I give you my recommendations, and then will have you guys to then I'll have my Q&A to answer any questions that you guys may have, and hopefully my answers that I give you will be satisfying answers. But my biggest but what I want to do is present to you our plan and our recommendation as to whether or not we should move forward. So let's begin. Illinois healthcare reform. In August of 2019, Governor J.B. Pritzker signed a Medicare reform bill into law. This new reform bill will allow the Medicare application process to be easier and faster. In the past, Illinois had a problem with a backlog of the Medicaid applications. There were thousands upon thousands of Medicaid applications that were delayed and not being processed. And this caused a big problem with the residents of the state of Illinois. Some of the residents wind up losing their insurance, or there was a big gap in their insurance. And for those that have chronic illnesses, or for those that may be on monthly medications, not having their insurance was a big issue. So what Governor Pritzker did, he signed this bill into law. He signed this law. He signed this bill into law, which allowed the applications to be taken care, or the application process was a lot easier. So now the application process is a lot easier, and there are not as many applications just sitting on people's desks waiting to be processed. There was as much as like 121,000 applications that were just sitting around and not being worked on. So now, because of this law, because of what Governor Pritzker did, this allowed the application process to be a lot easier. And this was good for the residents of Illinois, so because now there was no gap in their insurance. The denial process to get recertified, or even to just get their insurance, was down a lot. And this increase, or this was a big huge step, or a huge progress for the state of Illinois. Now, Illinois, all of the residents in Illinois are required to carry health insurance. And for those who don't have health insurance, there's a stiff penalty, a penalty of $695 per person, or 2.5% of their annual income. So with Pritzker signing this new bill, this greatly cut that penalty down. Now, in regards to the state of Michigan, in 2013, the governor of the state of Michigan enacted a Michigan Pacific expansion, or Medicaid expansion law, and it is called the Healthy Michigan Plan. And with this plan, the primary purpose of this plan was to allow the Michigan residents to get insured, but also to for people to find out, or to run a study to find out how this plan, or this new healthcare system, is affecting the Michigan's health. And the study showed that with this new plan, there was a great increase in enrollment. As like with the state of Illinois, the process was a lot easier. Getting the determination as to whether or not you can get insurance was a whole lot easier. As with the state of Illinois, Michigan does have a federal state penalty, which is the same, $695 per person. But in addition, it does have another penalty for children, which is $347.50. So the legislation and the government system of both states encourage their residents to get their insurance to be covered by healthcare insurance. Now, in my study, I have found that the state of Michigan and the state of Illinois do have some similar attributes. One is they both provide federal help for the purchase of the insurance. So if the person is unable to afford the insurance on their own, the state will help them. The marketplace for the insurance for both states is healthcare.gov. Like I said, there is a state federal penalty. And most importantly, if there's any type of pre-existing conditions, the person will not be denied insurance. The states must cover them. The big differences with these two states is that in order to get insurance with Illinois, you have to be a resident of Illinois, and vice versa. In order to get insurance in the state of Michigan, you have to be a resident of the state of Michigan. My recommendation is actually to go with the state of Michigan, simply because the state of Michigan does have similar attributes as the state of Illinois. And not only that, expanding our business into the state of Michigan will increase our patient population, would allow us to increase our provider population, not only just a regular a pediatric, internal medicine, a family practice, but also our specialty doctors. It would be a great profit for the company, and it would increase business itself for the business. It will be a great move for the company. Not only will the company benefit, but also the community in itself. And with that, I thank you for I thank you for taking your time out of your busy schedule and listening to this presentation. And now, although it was short and very simple, I will take any questions. Other than that, you guys are excused and have a great day.